will make a difference in the lives of your... Sorry, you're so aggressive.
You're gonna make a difference.
Okay, you're gonna make a difference. Well, hello there. It's Professor Fundus.
And Amygdala NP.
With Specialty Nursing.
An educational space where nursing minds can learn and grow together.
Created for nurses.
By nurses.
For nurses.
By nurses.
That's us. We did it.
Supporting you is our specialty. I'm going to show you how to relay vital patient data across your care team. The acronym we use is SBAR: Situation, Background, Assessment, Recommendation. SBAR was originally used in the military to quickly and efficiently communicate. It is the gold standard for reporting, used for status changes, updates, shift reports, etc. If you've ever had a conversation with a toddler, you probably already know it's important to relay information in a concise manner.
Fundus, what's going on?
I went outside and the chicken came. My ball first. I'm afraid if I look at it, I hurt my toe.
Okay.
There will be blood.
Oh, your toes hurt?
Yeah. I want to look at it. You look at it.
Got your toe.
Is it bad?
Yes.
I knew it. Efficient communication is even more vital in the nursing world. We have got a doozy of a patient for you. Okay, so get this. This poor lady, she spilled my coffee. Hang on just a second. This poor lady got up to go potty in the middle of the night.
Okay,
the floor was still wet, and she
patient?
slipped and fell. Who's the patient?
Yes.
Oh, what's her name?
You
no,
don't know
not
the patient's
triage.
name?
Not in triage. In room 1.
What floor are you on?
This is med surg.
Who's working with you right now? Who's your charge nurse?
Tina. Tina's on charge.
Okay, can I talk to Tina?
She is elbow deep in a Foley at the moment. This will just take a second. So this lady comes in. She falls down to her knees in her bathroom. Bilateral fractured tibias.
Okay, where are you exactly?
Where am I?
Yes, where are you in the hospital?
At the nurse's station.
What floor are you on?
Oh, 3rd floor.
Here's what I'm going to do.
Okay.
I'm going to come up there.
Great. That sounds good.
And then I'm going to try to figure out which patient you're talking about.
Oh, Jones. Her last name is Jones.
I will be there in 5 minutes.
Practice makes proficient. Perfection is unattainable. But proficiency is well within our reach if we commit some time and practice to the cause.
So we know what SBAR is and why it's important. But do you know how to give a quality SBAR report? Let's show you.
Situation. This is the most critical data to relay. What is going on with your patient right now? This is the hook on the first page of your novel. This is your YouTube thumbnail. This is the flashy action sequence at the beginning of your movie. You need to grab the attention of whoever you're speaking to. Take attention and just grab it.
Just grab it.
If a patient has presented to the ED, this might be their chief complaint. For an admitted patient, this might be their diagnosis or a complication that's developed. This is the priority problem.
Background. What is the pertinent information that a provider needs to know to make informed decisions? This heavy emphasis is on pertinent history. If your 87-year-old patient presents with a bleeding wound, the provider is really a lot more interested in the fact that your patient has thrombocytopenia than the fact that they had an appendectomy 30-something years ago. Hypertension or diabetes may impact directly the patient's plan of care and their likely outcomes. Lifestyle factors like alcoholism or polysubstance use could be vital details your provider wants to know. A family history of heart disease could inform the plan of care for a patient that's presenting with chest pain or shortness of breath. If a piece of patient data is likely to influence the patient's primary problem, consider adding that to the background.
Assessment. A combination of subjective and objective data. Subjective data is anything relayed to you by the patient, family, support people, etc. Objective data, things observed directly by the nurse and care team. The assessment provides a snapshot of how the patient is doing now.
Recommendation. This portion can take various forms. It can be a request for orders or a proposed next step in the plan of care. The recommendation that you give should seek to address the patient's problem. Here's a pro tip. Make sure you know what you will be asking for and next steps. Whenever you bring a problem to the care team table, try to always include a possible solution. And don't feel bad if the solution that you bring isn't the one that they choose as the next step. Just be prepared for what that next step might look like. Would you like to open the operating room? Can I give this patient XYZ medication? Do you want a fluid bolus? Shall I hang an antibiotic? May I get an order for restraints?
We need those restraints.
Please? Forming a recommendation can feel daunting, especially if you're new to nursing or to the unit. Nursing is about teamwork. Reach out to your colleague.
Help.
Or ask a charge nurse if you feel like you could use a little bit more support.
That's about 10 mark.
You'll also get a feel for the providers that you work with regularly and what kind of input that they expect. Some will welcome your thoughts, and other providers may simply want your question of what would you like to do next.
Want to see SBAR in action? This would be a nurse to a provider example.
Oh, Jones! Her last name is Jones.
Let's try that a better way. Please don't be that nurse.
Oh, Jones!
They don't like it. If you're nervous or haven't given many SBAR reports before, you can have your notes beside you. Jot out some ideas so you don't get lost. So here's a good nurse to provider example.
Nurse practitioner amygdala.
Hi, this is Nurse Fundus RN. I am on the Med-Surg 2 floor, North Hall, in XYZ Hospital. I'm calling you about patient Mrs. Jane Phillips. Mrs. Phillips had a heart attack a week ago, and she was admitted yesterday through the ED for new onset chest pain. Her pulse is 126, and her blood pressure has been 100/60. She has rapid shallow breathing and reports restlessness. Based on her history, I am very concerned she could be having a cardiac event. I have started her on the standard order for O2 via nasal cannula, and I'm requesting an order for a stat EKG so that you can review it immediately. Is this an agreeable plan to you?
Absolutely. I'm going to come and see her in just a few minutes. Go ahead and initiate the chest pain protocol fully.
Yes, absolutely. I'll start the chest pain protocol.
Thank you.
Thank you. Let's try another one.
I'm going to talk to you a little bit about a patient in room 3.
Okay.
This is Sherry Smith. She is a 16-year-old Caucasian female brought into the ER with complaints of abdominal pain and fever last night.
Okay. What time did she come in?
2:15. Sherry's mom reports that at approximately 2 o'clock in the morning, Sherry woke her up. She was complaining of intense stomach pain around her belly button. Mom took her temperature and it was about 101.6 at that time.
Ooh.
In her assessment, her last vital signs, temperature is 101.4. Her respiratory rate's 25. Pulse is also 95. Blood pressure 140/80. O2 is 97%. We did do a urine pregnancy test and that did come back negative. She's still complaining of stomach pain in the right lower quadrant, and she is having some rebound tenderness.
What is she rating her pain?
A 6 out of 10. Nurse practitioner had been in to see her once before. She's vomited twice in the past hour. Any movement at all is making her stomach hurt. Recommendations. So our lab results are still pending, but I've notified nurse practitioner amygdala with a request to order an abdominal CT. Is there anything else that you might recommend, request that you have for the nurse practitioner?
Let's see, you've got the labs in already. Do we have any pain medication on board?
She has had ibuprofen. She's had 600 milligrams at 2:30.
Thank you so much.
Thank you.
I actually wrote, it's a real report. We don't mess around.
Real report.
You have got this. With time and practice, you can go from clumsy, who's the patient?
Yes.
What's her name? To perfectly proficient. What is she rating her pain?
A 6 out of 10. We hope you found this discussion helpful. Do you have any tips or tricks for communicating effectively with SBAR? Let us know. Give us a comment below.
We encourage you to bloom where you've been planted. You're gonna make a difference.
You're gonna make a difference.
And if you don't, we're gonna come to your house.
You will make a difference in the lives of your patients because of who you are.
And in ways only you can. Positive change is brewing. Take care of yourself.
Be well. I totally put my mouth on that cup.
Oh, good.
Mindful meditation. We'll cover that in a different video.
Mindfulness.
Mindfulness, a bunch of crap, but also sometimes works.
Amygdala and P or
I
psych
know.
and P.
It matters.
It does matter.
Mindfulness is important.
It's key. Crap. Cheers.